Well, hello and welcome to the latest episode of Remote Works, a Citrix virtual series. I'm Tim Minahan, the Executive Vice President of Business Strategy and the Chief Marketing Officer here at Citrix Systems. And I have the honor of being your host and moderator for this very timely discussion on healthcare's response to the COVID-19 pandemic and what it means to the future of medicine and the role technology will play in enabling it. On the front lines of the COVID-19 response, hospitals around the globe have had to react rapidly to get staff home safely and to transition to a new model of care nearly overnight, expanding emergency response capacity, establishing satellite testing clinics, and accelerating telemedicine for other patients. And we've heard quite a bit about the heroic efforts of frontline physicians and nurses and the tireless hours and risks that they've endured to treat patients and save lives. Well, today we're going to go behind the scenes to uncover the rapid response stories and tactics that healthcare IT leaders undertook to adjust their application delivery and security approaches so that those frontline medical workers could adapt to this new model of medicine and better test and better care for patients. To share firsthand experiences on how hospitals had to quickly rethink and adjust to these new service models, and to give us a glimpse into what the future of healthcare might look like, we've assembled a very diverse panel of IT leaders from healthcare organizations around the globe. And I'd like to welcome our first guest here today, Lisa Pratt, the enterprise architect from the University of Vermont Medical Center right here in the US. Welcome, Lisa.
Thank you. Hi.
Thanks for joining us. Well, next up, hailing from the UK, we have a dynamic duo, if you will, from Gloucestershire NHS Trust, the Chief Digital and Information Officer, Mark Hutchinson. Mark, welcome.
Thank you.
And last but certainly not least, Steve Hardy, the Associate CIO there at NHS Trust. Welcome, Steve.
Thank you.
So let's jump right into it. Mark, we'll start with you. While the National Health Service is a household name in the UK, our global audience may not be as familiar with the NHS. So you could start just by telling a bit about the Gloucestershire NHS Trust and your scope of IT operations there and how you had operated, pre-pandemic.
Yep, so the National Health Service covers the whole of the provision of healthcare in England, and we are responsible for secondary and tertiary care across the county of Gloucestershire. So we cover a population of around 700,000. We have about 1,000 beds, and we have around 8,000 staff. And all of a sudden, as with suppliers, as with companies up and down the country, when the pandemic hit, we had to ensure that as many of our admin and back office staff as possible could work from home. So almost overnight, we needed to have around 2,000 staff able to work from home, and we have tried to achieve that. Without buying thousands and thousands of laptops, but instead by ensuring that they could go home, use their own personal devices and access the clinical systems or the administrative systems that they needed in order to be able to do their jobs from home.
Right. Well, let's build on that a little bit there. Steve, I expect we'll spend our future discussing the world in pre and post-pandemic terms. As Mark just said before the outbreak, NHS Trust wasn't necessarily set up for full-scale remote work, relying on VPN access for a select group of workers. But take us back, if you can think that far back, just a few months ago, and describe the remote access solutions NHS Trust had in place before the pandemic and what the experience was like for employees back then, using VPN and the challenges, it may have initially posed for IT.
Yes, I think before COVID hit, we probably had a few hundred users who were enabled for remote access, but it was very rare that we had any concurrency in that. So we maybe had 10, 15 people in the evening logging in, and we actually saw that on the first day of lockdown. We had a lot more people working from home, and all of a sudden the bandwidth constraints we had, and even the simple things like running out of IPs because we had more people than ever all trying to log on at the same time, just showed us it wasn't a scalable solution, easy to roll out at a pace for all of our users.
Well, we're going to get to the second part of that story, in a moment. But let's turn our sights now back to the stateside here. Now, Lisa, the University of Vermont Medical Center had a pretty robust work from home platform already in place, before COVID-19 hit. Can you share a bit what your setup looked like pre-pandemic?
Sure. So we have a Citrix NetScaler gateway protected with multi-factor authentication. We have a full Citrix virtual app and desktop environment with the vast majority of our applications available to our end users, and quite a bit of use already on a day-to-day basis in that environment. We had sufficient capacity to be able to spin up some more desktops and apps as needed to support work from home. I think our biggest challenge was trying to be able to support clinicians who are working from home, trying to provide telehealth even from their houses. So now, as everything started to transition to telehealth, we had physicians who were actually working out of their homes doing these telehealth visits. And our virtual environment really wasn't up to snuff in regards to being able to handle the video technology that we were using for those telehealth visits. So we didn't really have that optimization that we needed, and supporting them from home was challenging because of that.
Yeah, so the follow-up question to that then is, you didn't arrive at your final platform here kind of overnight. So how did you navigate your way to kind of a single consolidated platform for app and desktop delivery that did indeed support the needs of, let's say, a more work from home type environment?
Yeah, so for telehealth, we really had to train our users to kind of take their Zoom video visits outside of the virtual environment and really run those from their own personal computers. And then in the hospital, we had to come up with some more creative ways to be able to deploy the ability for people to use Zoom outside of our virtual environment.
Okay. Well, Mark, most companies kind of talk about digital transformation projects in terms of months or even years. Yet, as you said earlier, at the NHS Trust, you were able to get 2,000 staff safely working from home within just 48 hours. So how did you rally so quickly in the face of the pandemic?
So Steve will be able to describe the technical solution, but we were in a really fortunate position in that what we had already designed, what we had already planned to be rolled out was in place. We bought solutions, we'd got hardware on site, we had kind of compute capacity that we had available to us. We also had quite a detailed, well worked out 9-month plan for rolling out that implementation. And then we just asked the teams if they thought they could do it in 9 days. And then in the end, we had a solution that was, able to be accessed by some people within just 48 hours. And Steve and the team need to take a great deal of credit for that.
Great. Well, then let's turn to Steve. Steve, as we drill into that, for years we've been talking about, BYOD, bring your own device to work. But in order to respond so quickly and keep hospital staff connected during the pandemic, you take a little bit different approach to BYOD, more like, keep your home device and we'll bring the office, or in this case, the hospital resources to you. Can you explain a bit more about the strategy and thinking, behind not buying laptops and devices for every employee when the pandemic hit, and how you were able to get the necessary clinical apps to frontline workers, regardless of the device they were using or where they were working?
Yeah, so I think Mark touched on it, that we didn't want to be buying thousands of devices and have thousands of laptops, then to work out how we integrate into our environment properly post-COVID. So we looked at what our long-term strategy was, moving towards a VDI infrastructure, and just sped the timescales up significantly. So similar to Lisa, we deployed a couple of NetScaler gateways out in the internet to basically secure a virtual desktop infrastructure internally. So we had some spare capacity in our compute that we used to deliver remote shared hosted desktops, and we use Citrix app layering to basically, instead of having to create a new gold image, having to manage thousands of desktops, we used app layering technologies to just package the apps and elastically layer them in to the sessions for our users. So even though we're using a shared hosted desktop, we're able to give each user their desktop with their apps at quite a pace. Yeah.
So
I think
you're able to, able to take that golden image and personalize it on top of that. Let's build on that experience concept a little bit further. So, using your own device can introduce, let's say, wide variability in that some employees may have the latest laptop or tablet, and others, may have, say, some older devices at home. So what has been the feedback from hospital staff and their work experience using their own devices in order to get their work done?
I think generally it's been a really positive feedback. A lot of people are quite happy using their own devices and know how to use them. By using VDI to just give them a NHS desktop on their own device, they're able to just seamlessly kind of flip between their device and the work desktop as they needed. There wasn't a training need. There wasn't all of a sudden I need to get used to how to use Windows 10 when I'm only ever using a Mac at home. So I think it's been really well received by the users and has got past the boundary of probably a lot of training needs and just the sheer scale of numbers we need to deploy 1,000+ laptops.
Right, not only enabling you to mobilize much quicker, but helping to drive adoption by the familiarity that the physicians, administrators, and other end users had with the technology they were using, a consistent work experience. So excellent. So Lisa, let's go back. You talked before about needing to adapt, within the face of the pandemic, retraining folks on what the best practice or use is. But you've also innovated. So when the pandemic hit, your team quickly thought of ways that you could leverage your existing IT environment to create innovative new solutions to help healthcare workers that were on the front lines daily with COVID-19 patients. So tell us a bit about your previously mentioned kind of consolidated IT infrastructure and how it allowed you to empower new health service models, particularly, how you introduced iPads and new solutions, into the hospital rooms for better care for patients.
Sure. So again, one of our challenges was that the Zoom optimization within our virtual environment is not something we had implemented yet. And we had some limitations with our thin clients that was kind of preventing us from being able to do that quickly. So we transitioned and really thought of other ways to give people the ability to use Zoom in our hospital. iPads managed with the Citrix endpoint management system in the cloud, that combined with Apple Business Manager gave us the ability we kind of just ordered a bunch of iPads, created a profile for them. There was one afternoon just in particular I can remember where we probably had about 8 people come into the office. We unboxed about 100 iPads, got them enrolled, fully managed. The only thing that was on them was Zoom and connected to our Wi-Fi. We were able to clean them off, box them back up, and have them ready for deployment within probably 2 or 3 hours. So that was really exciting to be able to do that and have a fully managed iPad with Zoom on them that we could hand out. Those iPads were deployed in a number of different ways. Some of them were deployed to local skilled nursing facilities in the area. Those were used to allow our clinicians to be able to continue to provide care to those people without actually having to physically go to those facilities, reducing the risk of the exposure to the virus. They were then also used to keep those people connected with their families during the pandemic. So they were able to use that technology to keep them connected. We use them for telehealth video visits. We use them in the patient rooms. So in the COVID-19 patient rooms, one of the big uses was to set up an iPad on a stand in there, and then from the nurse's station, the nurse could call that iPad and have it auto answer and be able to interact with those COVID-19 patients in a way that was safe and minimized exposure and contact, and also saved on PPE, which was huge because PPE was in very short supply at the time. So it allowed the nurses to have more interaction and more contact with the patients, making the patients feel less isolated. And then also used to connect those patients with their family members as they were in their patient rooms with COVID-19, not being able to be around their family. They were able to use that technology to keep them connected with their family during that time.
Yeah, what an incredibly phenomenal story of innovation, in the face of the pandemic, not only helping to provide better better patient care, but actually helping to stem the spread of the disease. And I particularly like that you also thought about the family lives of your clinicians and physicians, and being able to allow them to be connected without putting their own family in at risk. So Mark, let's transition just a little bit back to NHS. You've also used this time as an opportunity to drive new innovation. Tell us a bit about the e-observations functionality that the NHS Trust added back in March.
Yeah, so here in Gloucestershire, we were scheduled to go live with some electronic observation functionality, collecting those within our new electronic patient record. Just the second week of March, literally just as COVID was really beginning to have a real impact in our hospitals. We had to make a decision as to whether during that really busy period we wanted to implement some new technology and a new solution or not. I think we made the right decision because we decided to go ahead with that, even just as things were getting really busy. And the difference that has made for our clinicians in terms of being able to identify the deteriorating patients, being able to make sure we understand as staff sickness levels rose during the pandemic, we were able to make sure that we identified the areas that need the greatest levels of staffing and made sure they were they were adequately staffed. Make sure that even though we operate across two main sites, on-call clinicians at one site were able to remotely see the observations for patients who were on the other site and step in and be able to ensure that they didn't just notice that patients were deteriorating, but able to make sure that they got the care that they needed. The difference that's been able to make through this period has been really phenomenal. And even just national, because we're a national health service, we like to ask for all sorts of information from the hospitals every day or every week and gather it up. And one of the bits of information that they wanted partway through was, can we tell them the number of out of our 1,000 beds, how many of our patients are being supported on oxygen? And in the past, we'd have had to ring every ward and take down a note of the numbers and then add them up and send a return in. But instead, we could just press a button on the system and be able to access all of that information and send it and submit it nationally.
Yeah, it's really incredible, both of your stories from UVM and NHS, and how you're using technology enabled innovation to really handle that risk we all heard about of protecting your very scarce resources, whether it's beds or whether it's PPE, and making sure that you had sufficient supplies on hand by using technology to limit interface, physical interface. So that's a really creative and necessary innovation in the light of the pandemic. One thing I'm hearing, Steve, maybe we'll switch back to you, from IT leaders at other hospitals and literally other organizations around the globe, is that the ability for IT to mobilize so quickly and support more flexible and innovative working models has really elevated IT's perception and trust within the organization. You have both to you and Mark, have you seen this in NHS, and what do you think you can do with this newfound trust?
Yes, I think it's definitely opened up some new opportunities for us. There's the confidence in IT to be able to roll solutions out at a scale, like Mark was talking about with the observations, and then being able to enable the remote working. And it's what opportunities that opens up for us as a trust in regards to office space with remote workforce. And actually within Gloucestershire, the area we do find recruitment quite hard for some specialist roles. I think this past few months has proved that we can enable remote working, enable working as a team from anywhere in not just the UK, anywhere in the world. And actually some of that learning and kind of some of those opportunities are really key opportunities for us to grab onto as an organisation.
Yeah, great. Well, Lisa, let's kind of extend that conversation to you around this kind of elevated IT role in helping, not just in the midst of the pandemic, but driving forward. One of the things we've seen is the pandemic has also elevated the importance of agility for organizations, literally in every industry, with many looking to shift to more variable operating models so they can scale up quickly in the face of the next inevitable unplanned event. So for IT, this in part means, taking, what might have been a 1 to 3 year cloud transition plan and accelerating it into a few months. UVM has started to explore moving to the cloud. And, what does this look like for your team? And then, what sorts of benefits and agility are you hoping to achieve with that shift?
Yeah, so we definitely took advantage of the Citrix endpoint management in the cloud, obviously heavily during this pandemic with the iPads. We are at a strategy point where we're trying to decide what other Citrix, parts of our Citrix environment kind of could be transitioned to the cloud. We want to make sure that whatever we do safely. Having our electronic healthcare record is certainly something that is, readily available to us at all times, is something that's very important to us. So we want to make sure that, if the cloud's not available, can our users still get to our EHR? But at the same time, we want to be able to take advantage of some of the features of being in the cloud and the full workspace environment that's there, the intelligent workspace, kind of giving that user the experience of having all of their files and their apps and desktops all in one place would be nice to have. But want to do so in such a way that we have that availability if the cloud were unavailable, so that we can still get to our stuff.
Right. Well, it seems that you're already, creating new innovative models to better service patients, as well as keep your staff safe and productive. Mark, let's build on that. We've spent a lot of time discussing how Gloucestershire was able to mobilize and adapt its service model during the pandemic, keeping your employees safe and creating new ways to help patients. What about after the pandemic? Will we just go back to operating as we did before, or are there some key lessons learned or new service models that you expect NHS to put in place once we get back to some semblance of this new normal, if you will?
Yeah, there are a number of things that we are trying to make sure that we hold on to so that things don't just return to the way they used to be. Investing in technology and supporting the team is really important. Ensuring that staff can continue to work from home has got huge environmental benefits. It's got really significant benefits for those employees, and of course it helps the organisation. And so looking at how we can support those people on an ongoing basis, continue to develop and improve the offering for staff working at home is really important. A huge proportion of our ambulatory outpatient appointments moved off-site very quickly at the beginning of the pandemic, and we are still having many more than 50% of our ambulatory appointments are happening remotely, either via the telephone or by video, but both enabled by having an electronic patient record. And so that being the default way that we interact with our patients going forward would make a great deal of sense and be of benefit both to us as an organisation, but importantly to patients who would no longer have to travel sometimes quite considerable distances to come into the hospital, and continuing to roll out our electronic patient records so that all of that interaction could happen more easily remotely will be really important on that journey.
Right. So it seems like that the future will be more digital. It'll be more remote. We really focus on the benefits that could provide to patient care, to staffing, to access to expertise. But Steve, let's shift. There's another benefit, and I want to have you discuss it a little bit. There's also an environmental impact of these more remote work models, healthcare delivery models that seem to be waking up, that people are becoming aware of because of the pandemic. In fact, just a few weeks ago, I hosted a panel with IT leaders of global colleges and universities, and Cambridge University right there in the UK said they'll continue remote work as a key pillar of their goal of becoming carbon neutral by 2048. So, is the NHS Trust thinking about reducing its own carbon footprint by having less admin staff in the office, by embracing some of these new telemedicine models?
Yeah, I think definitely it's given us a model of a new way to work. Whether some of the carbon impacts are just the drive-in, the parking at the hospital, the amount of times before all of this hit, you would see patients driving around looking for parking spaces. Just the massive reduction in the carbon footprint of staff and patients driving in. And yeah, the greater flexibility for staff to be able to work from home, and it's about enabling that model and giving staff the option and patients the option about, do you want an on-site appointment, do you want a remote appointment, do you want to be able to work from home, do you want to be able to work from the office? I think all of that is definitely, like Mark said, something we want to keep up. We want to be driving the option, and I think we do need to be looking at some of kind of the new normal, the new defaults of where that works, but undoubtedly there's massive environmental and green opportunities here.
Yeah, so pandemic has really kind of it's maybe accelerated some of our thinking around these and exposed the benefits to patient care, certainly to employees, our physicians, clinicians, and administrative employees, and even the environment. So let's build on that. And Lisa, maybe end with you here. What about at UVM Medical Center? Has the pandemic opened your minds to new models of work and healthcare services that you plan to continue to employ in the future?
Yeah, certainly. So we went from approximately 60 telehealth video visits a week to over 7,000 at peak during the pandemic. Now that's come down a little bit as patients have started to transition back to going into the office a little bit, but it's never going to go back down, to that extent. It's clearly a way of the future here. And the concept of the clinician being at home providing those telehealth video visits isn't certainly not something that we were thinking of when we were talking telehealth before all of this started. So it's certainly fast-tracked our telehealth presence in the environment. The limitation that we have is the, like I said, the video optimization for those video conferencing technologies, and having that Citrix HDX optimization available to us is great. We're really focused on getting our endpoints to a point where we can fully take advantage of that, and then really looking to integrate that telehealth into our electronic health record in more of a way where a patient can join the telehealth meeting from their own patient portal, and the physician can join that telehealth meeting directly from within that electronic health record. And bringing that full experience to both the provider and the patient is really our end goal and very key to our organization. So working from home doesn't just become about the people who can do their jobs from home. It really becomes about being able to provide clinical care from home when needed.
Right. It seems that both the technology as well as just perceptions about what medical service is, how it should be delivered is really beginning to change, in light of the necessity we all find ourselves in and needing to do more kind of remote telemedicine. So I look forward to an exciting and I would say accelerated, future of healthcare here. Well, we're going to have to wrap it up there. As you can see, from the UK to the US, the healthcare system has had to think innovatively these last few months to quickly adapt to the needs of workers and patients during the pandemic. And they're thinking very, very differently about the future of work and the future of healthcare. I want to thank our panelists, Mark, Steve, and Lisa. Thank you for sharing your unique insights and your experiences. Thanks for joining us. Now, next up on Remote Works, we'll be taking a look at the environmental impacts of remote work models and providing 6 ways your company can help reduce its carbon footprint. Now, for more information on how to guide, support, and enable a remote workforce, visit citrix.com/remoteworks. Until then, be well and work better.